Hello and welcome to all our viewers from around the world. My name is Kristen Schwartz, licensed midwife and MC here at Gold Learning and Gold Midwifery. And I am so honored to have here with me today Dr. Shawn Walker. And Dr. Walker will be presenting with us here at Gold again on breech birth. And we're so excited to have you here. Welcome.
Oh, thank you, Kristen.
It is so lovely to have you back here. And before we get started on talking about the presentation, I just want to let our viewers here a little bit, let them know a little bit about yourself. And I know you have such a vast background. You're a midwife, you're a researcher, you're an educator. And so tell us a little bit about your professional journey here.
Sure. Well, you may or may not know, I actually started out training in Florida as well as a CPM in working with other licensed midwives in Florida. But when we moved back to the UK, I then became a registered midwife here in the UK. And I've worked in all sorts of birth settings, home births as an independent midwife, birth centers, and in hospital-based practice. But very early on in my career, I identified that there were many women who wanted to access safe vaginal breech births, including in hospital settings, who weren't able to do that. And in the UK, we have a national health service where women should be able to access their choice of mode of birth within the National Health Service. So I, since then, that beginning in about 2011, have basically dedicated my career to trying to carve out a pathway for physiological breech birth within hospital-based settings. And that's taken me all sorts of places. At the moment, I am a senior research fellow at King's College London, and I'm funded by an National Institute for Health Research Advanced Fellowship, which is funding my research. And my clinical affiliation is with the Chelsea and Westminster hospitals here in London, where I work 2 days a week as in a breech clinic, where I run a breech clinic and then coordinate the intrapartum care services for women planning a vaginal breech birth.
Oh, fascinating. Thank you so much for telling us about your really fascinating background, starting here in Florida and then now having your own breech clinic. And that's something here in the US, I have to tell you, we can only dream about. I don't know, at least in my area, about a clinic that is dedicated to breech. We're still are miles away from having a breech birth in the hospital normalized again. It is very difficult to get there. And but you're providing research, and this is what we need, right? We need evidence-based research. We need research to take into the practice, and that's why I'm so excited that you're here and presenting on research. And your presentation is actually titled "Using Research to Optimize Safety and Availability of Vaginal Breech Birth." Tell us a little bit about that.
Yeah, so when I started researching this subject, which really arose out of feeling like I might be able to help one woman occasionally plan a breech birth as an independent midwife, but in order to help change the way breech birth is done, there needed to be a stronger research base. And so I just started identifying questions. Well, in order to do this better, we need to answer this question. And I just feel like this is probably going to sustain my entire career because there are endless questions and very few people have been trying to answer them for the last few decades.
Yeah.
So there are obviously a couple of notable exceptions out there of both doctors and midwives doing breech research, but there are so many questions that we need to answer. So my presentation is going to be about some of the ways we've set about doing that or making a start to doing that.
Fantastic, wonderful. And this is so needed. I don't know if you probably remember that from your time here in Florida as out of hospital midwives. We are not allowed to have, a facilitate breech birth at home or the home birth or in a birth center setting. And my hopes, and maybe this is totally out of the, unrealistic and out of the picture, is that providing research like you do, evidence-based information that we can bring forward and say, look, in these cases, we have evidence that is providing information how safe a vaginal breech birth is. Do you see that in the future that maybe research will enable us to go forward and present it to lawmakers and possible see changes there?
Absolutely. And especially in OptiBreach, because the vast majority of births that have been attended so far in the study are attended by midwives.
Mhm.
So I have attended um, a, a bunch of them, but colleagues who are also working in other hospitals, other midwives, other breech specialist midwives are attending births. So we will rapidly be collaborating on building evidence base for breech specialist midwives working in hospital-based settings, although we have had some home births as well and some birth center births, because it's not really about place of birth, it's
Right.
about supporting women to make informed choices about what is best for them. But the key intervention does seem to be in our study, it seems to be a midwife, because midwives are the ones who work on call and work flexibly and are able to go to the breech births. And we obviously work in very close collaboration with our obstetric colleagues, but
Mhm.
they are less likely. I know in the States, often obstetricians do work on call for their clients, but that isn't the way that the National Health Service is set up. So obstetricians tend to work shifts and work periods on call, but outside of that, generally don't provide continuity of care in the same
Mhm.
way that midwives do.
Mhm.
So I think we will be making a really significant contribution to the evidence for midwives' involvement in normal physiological breech birth at term.
Wonderful. Oh, I can't wait for that. I can't wait to listen to your presentation. And oh my goodness, you have brought forward so much to the birth community and to training, right? It is important that midwives who, are trained in breech births, even if, here in Florida, we are not allowed to facilitate, but there are, of course, instances of a surprise breech, and we need to be able to know what to do in situations like that. And
Yeah,
that's where also your table comes in. You're wonderful. You
yeah,
made this algorithm, for us, and
yeah,
we have that in the other packages as well. We'll talk about this,
yeah.
and this is a wonderful piece of work there that I can highly recommend to all the midwives to look into that. Not only midwives, anybody who tends births and can benefit from that. And that has been based on years of research as well, right?
Yeah, and it's just like any other thing that's a rare outcome. So
Mhm.
you may not plan to be at breech births, but
Right?
you don't plan to be at women who suffer an eclamptic fit either. And
Exactly.
we all need to be competent to manage that. And our competence needs to be based on evidence. And
Mhm.
that is one thing that it hasn't been for a long time. It's been mostly people who have been perceived as experts and do have vast experience, but we have to realize that when, for example, you say, well, this is how I do it and this is a good thing to do, when people take that and
Mhm.
turn that training into practice, it might not translate into exactly the same thing as what you were actually doing. And so that kind of communication, which exists in education, needs to be subjected to tests and outcome measurements and things like that. A lot of it's very boring research, isn't it? But what it can lead to is can give us a lot more confidence in what we're doing.
Absolutely. And I am of the opinion we need more midwives in research. I mean, I see that in the UK, you have that in Australia. There's a lot of midwives who, not a lot, I wouldn't say a lot, but who go into research. Here in the US, it is for me, I'm still, seeing this is an area that we could do much better here. And I, also encourage student midwives that go into research, see what's there, because we need that. We need the evidence to make
Absolutely.
changes. And not just, as you mentioned, for the one family or two that we're serving or, here and there, but, on a much broader level.
Yeah, that's another thing I really like about our OptiBreach study is that what we have in UK research is you
Mhm.
have a chief investigator, which is me leading the research. And
Yeah.
then at each site, each hospital, you have what's called a principal investigator, and they will be responsible for doing the study at that site. And we have most of our principal investigators are actually midwives as well,
Mhm.
which is different because traditionally that has usually been an obstetrician and the midwife does a lot of the practical data
Right.
gathering, but they're not involved in the research leadership. So we're
Mhm.
trying to change that perception as
Yes.
well and say midwives really need to be involved in leading research
Yeah.
as well as just the practical aspects.
Absolutely, absolutely. Oh, that sounds wonderful. I can't wait for that. And before I let you go, what would you say is one nugget of advice or information that you hope that our viewers will take away from your presentation?
I would like them to not be afraid to intervene if they need to.
Mhm.
And I think I debrief an adverse outcome for a breech birth probably, sadly, about twice a month.
Mm.
And so often people are blaming themselves because they believe that maybe touching the baby was what caused the
Mhm.
adverse outcome. And my perception of listening to them is very different, and that you don't need to blame yourself, but we need better training so that
Mhm.
people are more able to help in ways that are actually evidence-based, useful, and actually will result in better outcomes. But please, people, we can't blame ourselves for doing things that we don't know better how to do. All we can do is commit to getting better day by day.
Love this. Commit to get better day by day. Thank you so much, Dr. Shawn Walker, spending time with me here talking about your work and the upcoming presentation. It's been such a pleasure.
Thank you, Kristen. Thank you so much. Bye-bye.
And for our viewers now, the presentation is part of a lecture pack here at Gold titled Advancing the Art of Breech Birth Add-on. That's an add-on lecture pack here to our midwifery conference, and the lecture pack will be available on February 1st. And to find out more about this presentation in the lecture pack and the other presentation, as well as the midwifery conference, please visit goldmidwifery.com. Thank you, everyone, and I hope to see you at the conference. Bye-bye.